My name is Jocelyn Zee. I am an intensive care physician here at JPS. I've been here for over 12 years. I see COVID patients every day in the ICU. The COVID-19 vaccines are safe. They have been extensively tested and reviewed by experts. There are some folks that are concerned of how quickly it was developed. Operation Warp Speed was warp speed, not because they skipped steps in the development of the vaccine. It's because they were able to overlap based on technology that had been utilized previously in vaccine development. Whether you're looking at flu vaccines, MMR, rubella, any of the vaccinations that have been developed, all of them have the potential for side effects. Usually the side effects that you will see are going to occur within either the same day or a couple of days after. There have been over 165 million folks that have been vaccinated as of August of 2021, and the report rate for the adverse effects have been very low. Some people are concerned that just like the flu shot gave them the flu, that the COVID-19 shot will give them COVID. The mRNA vaccines, those are just chunks of part of the virus. It's a spike protein. A spike protein alone does not cause you to have the disease. There is no possible way that the vaccination can change your DNA. mRNA does not enter the nucleus of your cell in order for that to happen, so it cannot change your DNA. There are microchips that are in the label that is attached to the outside of the vial in order to track shipment and what dose and that kind of thing. There is no microchip in the liquid that is injected into your arm. There have been no validated cases of miscarriages or fetal abnormalities from receiving the vaccine. Obviously, it is recommended to discuss it with your physician. Multiple societies highly recommend receiving the vaccine. We have seen folks that have been vaccinated that have had breakthrough cases. No one has said that you can't get a disease after vaccination. Their severity of illness is far less. Same with the flu. It minimizes your risk. Once you do receive your COVID-19 vaccine, you've already taken a huge step towards not only your health, but the health of others. Having said that, it is still very important because of the possibility of contracting the disease after vaccination that you protect everyone around you and yourself by wearing your mask and maintaining physical distancing.